There are some people that they won't wash themselves and they won't even shave. So I don't know what to say to those people. Oh. I'll just tell you to
We know what to
change.
say to you guys. Guys, share at once. We are on the Now What show today, and I'm with my guest, Nurse Riri. Okay, so we're here with her, and then she's going to be talking about everything personal hygiene today.
Okay, to start with, my name is Rita Eking, and I would like you to call me Nurse Riri. I'm a nurse and a content creator, a content writer, and a project manager. I own a Facebook page and a YouTube channel where I get to share my knowledge about personal hygiene, sexual and reproductive health, and also anything concerning health.
First question first. What is it like being a nurse?
Being a nurse, I would say it's actually beautiful. It's actually something that is satisfying because when you get to attend to a patient and the patient recovers, it gives you that sense of satisfaction that yeah, you've done something, and then you've given a life, you've given your arms to someone that was in need of help. So I feel satisfied to be a nurse and to practice.
Okay, so now we're going into personal hygiene.
Okay.
Me, I want to also learn.
So what do you want to know about
Okay,
personal
so
hygiene?
especially women. So we're going to
Okay.
attack the women first, and then a little bit of the men.
Would you want me to attack you? Okay, talking about personal hygiene.
Yeah.
I would want to start from the definition when we talk about women's hygiene. They are just practices that maintains the cleanliness of a woman. Let's start from menstruation. Okay, you're menstruating here, and because they have written there, it should be for 8 hours, and then you've seen that your pad has full in the space of 3 hours. Why don't you just go change it? Some people would want to wait till the 8 hours. Even some of them, they will use it till the night. Like they wait around 8 o'clock, let's say. They will wait till, let me say, 12 a.m. of the next day. They won't want to have a change of pad. Even if you don't want to shower, even if the weather was too cold and then you don't want to shower, at least just wash yourself and then have a change of pad. A doctor was like complaining that recently there have been cases of vaginal cancer. Yes, and you wouldn't know if it's all these kind of small things that will contribute to you having those kind of disease. And another one is, let's talk about your vulva. Like when you want to wash yourself, when I say wash yourself, you need to at least use water. You don't need soap, you don't need all those harsh
But
soap things.
I think someone said online once, I saw something online where a woman was saying that I heard and I read
Okay,
that it's improper to use soap on your
it's very important.
vagina.
Yeah.
So someone said that you're not to use soap, but you are not also to use just water if you want it to smell nice. That there's something else, like
Oh,
a
did he
product.
get to mention the product?
No, the whole instruction was do not use anything other than water.
That's it. Because the reason why that is because, to even start with, you're not even supposed to use anything to wash your vagina. There is a lot of misconception we have. Some There are different parts of the female reproductive system. It is divided into two.
Yeah.
We have the external part and the internal. This external part is like the mons pubis, labia majora. You can call it the vulva.
Yeah.
Yes, and that is the one you can wash with just water. With just water, you can wash it with just water. For your vagina, you should never wash your vagina. Vagina is self-cleansing. Any other thing that you are adding into your vagina can alter the pH balance of that vagina, and then it could lead to vaginal irritations and vaginal infection. So nobody should even advise you to even take anything inside your vagina. Even all these ones that we use our finger to do whatever is not advisable, it's not nice at all, because it can irritate the pH balance of that vagina and can lead to various infections like vaginal infection. Then I was trying to talk about the female reproductive system
Yeah.
so that we can get to understand this. The vulva is different from your vagina. Your vagina is inside, like it's one of the internal reproductive organ. After
Yeah.
the vagina is the cervix and then the womb,
Mm.
which we also call the uterus. So it's always inside. The one we call vagina is the vulva, the one you can easily see, and then the one inside is the vagina. So we should get that straight.
How about like people who fix nails?
Okay.
Is that hygienic? Because the dirt is going to like go inside now.
Well, there are some persons that fix nails and then they tend to pay attention to those inner layers of their hands. For those people, I could say if you know how to, if you can practice personal hygiene, then you go for it. But if you know that, if you fix that nails, you can take 1 month, you will not even try to remove some dirt. There are some
It
people
will
like
be
that
there.
now. Like, if just it has reached 1 month, you cannot even remove anything from your hands. Please don't go there. Just don't even fix nails if you
Hmm.
know you cannot practice personal
Please,
hygiene.
please. I think artificials these days restrict a lot of like cleaning, like the thorough cleaning. Like
Okay.
imagine putting latches and then you're not supposed to like really wash your face really well, and you're supposed to like go like
You
this.
could They still use I don't know, call it wipes, then they wash their face, wash hair, wash all those things. Doesn't matter if you know how to take care of yourself.
Hmm.
It doesn't really matter if you know how to take care of yourself. The one that I would say can pose how do I call it, complications are those ones like plastic surgery or breast implants. Those ones, because if you don't even meet the right person, like a professional, to do
Hmm.
it for you, you can mess up your life.
So now this thing about having hair under the armpit, is
Okay.
that advisable?
Well, I've read a lot of books about this particular thing, and the truth is that some persons feel if you have hair around your armpits that you're very dirty.
Hmm.
Yeah, but it's actually not true.
Yeah.
There is no how do I call it? There is no proven fact that people like that are dirty, as long as you know how to maintain personal hygiene. As long as you know how to maintain, if you feel that okay, shaving makes you feel good, you can go ahead and do it. But there are some people that when they shave, they actually come up with rash and bumps, all this kind of stuff. So they would feel, or they would just feel reluctant shaving. So
Yeah.
if you can feel reluctant shaving and then you can also still practice personal hygiene, that's very fine. You're not dirty.
Because I
But
heard
there are some people that they won't wash themselves and they won't even shave. So I don't know what to say to those people. Oh. I'll just tell you to
we know what to
change.
say to you guys. Guys, share at once. But I think people with hairs like in the pubic area need to like do something more.
Like,
Do you still have to base like a normal person?
Jesus
You
Christ.
should base more.
Like, okay, I would say if you know that you cannot be shaving every time, at least when you're washing yourself, you should pay close attention to that place.
More
It's just
attention.
like people that have how do I call it, your navel, and then it's actually inside. I don't know how to
I
describe that.
understand.
Yeah, there are some people that they will not even, since it's hidden, when they are taking their bed, they will not even want to check there how the place is doing, watch that place, because it actually packs dirt in there. So if you don't get to wash that place, it will be dirty over
Mm.
time.
Mm.
So it's just like that. If you know that you are not good at shaving, or you don't like shaving, or shaving doesn't like your body, you should just try to pay close attention when you're washing. You don't need sponge to come and be doing. Just wash it and pay close attention to it, and you're good to go. Just practice personal hygiene. Personal hygiene is the key.
Now talking about personal hygiene, this whole skincare stuff that's really coming out these days for a
Okay.
lot of women. Because
Okay.
I'm not really seeing skincare
Glow in the dark. Oh
glow,
God.
because I personally I love good things, but
Okay.
I feel that sometimes good things comes with a lot of warnings and precautions to them, because people just buy products these days without actually knowing what's good for their
That's
health.
true. That's true.
So do you think this skincare really affects, some of them affects the skin to a point of getting there's cancer of the
Of the skin, that's very true. That's
shey una
very
don hear am?
true. That's very true. The thing about this all this skincare is that In fact, there was ones that my colleague actually used a skincare product.
Yeah.
And what I saw was actually not a skincare. It was actually a skin destruction. So so I don't know the composition of whatever the person made for her.
Mm.
And believe me, it was expensive for a schoolgirl to afford that and then use that on her skin. So I wouldn't I'm still saying this. If you really want to do all of those things, we have dermatologists, those people that are specialized on those kind of areas like the skin. So if you want to do certain things like that, you should meet a specialist. Meet a specialist because you would get to know about this thing and then you know what you're actually applying on your skin. You have the right to ask, what is this thing that I'm taking? How is the composition? What did you use to do this? So that if anything happens, you can hold the person responsible.
Do you
Okay.
think it's okay health wise? It's for pleasure, I know. We're all
Mm-hmm.
in. But do you think it's okay to give head and get head? Both genders.
Actually, I would say it's actually very wrong. But see, though it's for pleasure, but at least you should take precautions when you want to do some certain things and when you want to when the how do I put it, when the whole climax of a thing gets to your head, like you should know what to do. You shouldn't just get yourself overwhelmed. What is wrong is wrong. It's actually not healthy at all. Even when you're having sex, you should make sure you use contraceptive. Use something that would help prevent sexually transmitted infection or even unwanted pregnancy. So we have condoms and then someone would just go to have sex without it.
You know,
And at the end
most
of the
most
day,
people think that condoms is just to avoid unwanted pregnancy, but actually they're to avoid some infections. They're not just for
mm-hmm,
unwanted pregnancy. Even
mm-hmm.
for married couples,
Yeah, so
is
if you're not ready, don't go into it. If you're not enlightened about all these things, you shouldn't do it. Because I would see a young girl in the street, someone that calls me auntie, someone that calls me senior, being pregnant. Like how? And if you know that you are sexually active, you should learn to, in fact, make it your habit to be checking yourself. Go for test and know your stand. Know if you have HIV. In fact, go for HIV test and any sexually transmitted infection test so that you get yourself fine and you get yourself protected, please.
so. Are you still advising head?
Oh well, for the you, as I said already, what is wrong is wrong. It's not good. It's not healthy. So if he wants to go there or if she wants to go there, you can take yourself back.
If you know you're doing it, stop it.
Quit.
Get some help.
That's it.
Okay, guys, so we've come to the end of the Now show today, and it was fun. It was fun getting all the whole, the personal hygiene stuff. I love you guys, and I'll always bring good stuff that will help you. You get, okay? So we're calling it a quit for today. You already know our social media handles. You already know mine.
Nurse Riri, check me YouTube and on Facebook.
Yeah, on YouTube, Wisdom Godwin, and on Facebook, Wisdom Godwin. See you when next we see.
Bye.
Bye.
Stay healthy.
Yeah, stay healthy.